So one of the patients that I got to speak with one of our clinicians about was a 15-year-old boy who has patellar tendinopathy. So he's still actively playing sports and he's been coming into PT throughout the season, still participating in practice, still participating in games, but is still having a degree of sensitivity in that patellar tendon. Now, from start to finish, we're having a reduction in symptoms. We just haven't had a complete resolution of symptoms. So I was talking with our PT about what do we do next? What are the expectations? What do we communicate to the patient, to mom and dad? Is this an incident where we need to refer out, or do we just continue doing what we're doing? So we looked back at everything and really tried to get a better grasp on where we're at in this current situation. What are our options moving forward? And what would be some of those indicators to go either way? And come to find out, after we did a little bit of digging, she was accurate in that the individual is making improvements, and we're making improvements in regards to subjective reports of pain, range of motion, strength metrics, and overall just functional status. The one area that we do still have strength limitations, though, is just with pure quad strength. When we look at isolated knee extension strength, there is an asymmetry there. And then when we also looked at tasks such as an anterior step down off of an 8-inch block, and when we looked at the anterior direction of a Y balance reach, there were some discrepancies there as well. Now, they weren't as large as they were when we were looking at the asymmetry with the knee extension isometric test, which tells me this person is somebody that is good at compensating or finding ways to complete a task when we bring in other joints and other body parts. And that's why they were able to perform better with that anterior reaching and that anterior step down, because maybe they're doing something from a body positioning standpoint or a compensatory standpoint to hide some of that lack of strength in their quad. So the rest of the talk with our PT from here really circled around what do we do next? And this is an individual who was referred to PT from their primary care, but they had never gone to an orthopedic. And they had said, hey, go to PT and just come back whenever you're done. And they're obviously not done yet, so they haven't gone back to their physician. But I was telling her, at this point, we need to start making some decisions. We either need to figure out, due to just the nature of the condition, and this is speaking kind of globally, not just towards patellar tendinopathy, but you're going to have some conditions that do kind of ebb and flow, and you'll have periods where you do get complete resolution, but you may have some exacerbations, you may have some flare-ups along the way, and that's okay. And you understand that, think about chronic low back pain and neck pain. Those are incidents where people may come in for PT and we're able to get a very good grasp on it, and you discharge the patient, but then you discharge them with the understanding of this may be something that comes back around in the future. If it does, this is how you address it. And these are the things that you look for if your self-management strategies don't work, and it would actually necessitate you going back to your orthopedic or your primary care, your neurologist, whoever they saw, or coming back in for additional PT. So with her, really just getting an idea from the patient of how limited do you feel, how much is it affecting your performance on the field, your daily quality of life, and overall just the amount of discomfort you're dealing with, and is it putting you in the position to have any other issues come into play? Meaning, are we compensating on the field to where we're putting other body parts at risk? And that's going to be a conversation that she needs to have with the patient and kind of match that up against what she's finding from a clinical standpoint. The other part of the conversation is, do we need to tap in somebody a little bit more specialized from the medical side of things? We saw the primary care. Primary care did a phenomenal job of recognizing the issue, triaging out to the appropriate place. Luckily in Maryland, we're direct access, so we can be that initial point of contact. But when we do have somebody that has a degree of chronicity with their symptoms, sometimes it's not a bad idea just to tag out, get another set of eyes on this thing, send them to an orthopedic. And orthopedic's going to do one of two things. They're going to say, you know what, you're doing well, you would benefit from continued PT, let them know they're doing a good job, keep going in, we'll check back in X amount of weeks. And that's fine. That provides affirmation and confirmation on all ends that all boxes are being checked and we're doing what we need to do, and we can move forward without any hesitation or uncertainty. The other thing is they may go to that orthopedic, and the orthopedic may be able to provide something additional from an intervention standpoint. So maybe it's additional medication or just guidance in regards to how to best go about and triage overall activity levels. And then finally, you can also get to a point where if it's only strength that is the remaining deficit and all of their symptoms and issues are strength oriented, but they're competent and compliant with their strength activities and it's just a matter of time, then you may just start entertaining, is this somebody who's appropriate at this point for discharge to a home exercise program? And we let them know what they should be doing to help resolve those remaining quad deficits. So tendinopathy is always tricky. It's one of those injuries where it's often not serious enough to sideline you from an activity, work or sport, but it's preventing you from doing it and enjoying it to your fullest potential. So a lot of nuance. Obviously, everything's going to be case by case, but this was a fun one going through with one of our PTs down in our Anne Arundel County location.